Morning, welcome back. This is SaimaUkNurse. I'm back with another video, and in today's video we are going to talk about OET speaking. Yes, it is a very easy subtest in the OET, right? In the OET exam or IELTS exam. If you give IELTS academic, speaking is the most easiest subtest, I would say, and anyone can get band 7 or OET score B in speaking. Yes, you heard me right, and it's very true. I'll give you some tips and tricks how to ace OET speaking and how to pass OET speaking in one go in today's video. This is all we are going to discuss. All right, if you haven't subscribed to this channel, I provide information about UK nursing, each and everything around me, to be honest, and visa processing also. We can discuss that too. But if you have any queries or questions, let me know in the comment section, and I'll be more than happy to make a video on that particular topic on your request. It's exciting, isn't it, and interesting, and it gives me knowledge, and it motivates me also to make more videos, because sometimes I run out of ideas or topics, what type of videos I should make. So when you comment or you put it in the comment section, it gives me encouragement to make that video, and it also motivates me to make the video, and it gives me knowledge as well. If I'm teaching you, if I'm giving you knowledge, I'm gaining knowledge as well, so it works on the both sides. So that is really good for me and you. So if you haven't subscribed, what are you waiting for? Please consider subscribing. If you are a returning viewer, thank you so much for coming back. I can speak loud today. My baby is awake. He's just playing. So in speaking session in OET, as you all know, the timing is 20 minutes only, and you are given 2 tasks. It seems like very short test, only 20 minutes, but even 1 minute can take you down. So you need to be very careful about the time. You need to be very careful what you say in those 20 minutes, and how you convey the information to the examiner, or how you play your role in OET speaking. So let's dive into the video without any further delay. The first thing I want to say is you need to familiarize yourself with the time limit and the mechanism of OET speaking, and you need to know that the examiner is just an actor. He doesn't know what you're talking, all right? He doesn't know what you are saying. He's just listening to you as an English teacher, as an English examiner, or just an assessor to test your English, just to assess your English level. So the examiner is just an actor, nothing more than that, okay? Just an actor or an examiner to assess your English level, and you don't need to consider them as a patient. You don't need to they will not show you that they are the real patient, so you just need to behave like you are dealing with the real patient. But they themselves, they also have a set of questions that they are going to ask you. They will not answer you as the patients do in the hospital. They will ask you question which will guide you to answer them in an efficient way, and in that way they test your English level. All right, sometimes we ask the patient what kind of medications do they take, or if they have dementia. They'll not answer you. But in case of the examiner, in this case in OET exam, the examiner will tell you something, and he will prompt you to answer him. All right, he will prompt you to give him a detailed answer in English, because this is their way of testing your knowledge. So you need to make yourself aware of the timing and mechanism of the English test. That is my first point. The second most important thing you can do in order to pass your OET speaking is practice in English. Practice speaking in English with other people, or at your home, or if you are alone, in front of the mirror, or you can make YouTube videos and speak to yourself in front of the camera. Yeah, so in this way you are going to learn, and you will also notice what are your mistakes. So for me, I was very camera shy. I am still, but I still make YouTube videos. But while I was preparing for my OET speaking, I was just thinking in English, because I couldn't do it. I couldn't practice in front of the mirror. But sometimes what I would do, I would talk to my sisters in English, or I would talk to my husband in English. But most of the time I used to practice in my mind only. I will just create stories. I would just create stories in my mind, or think in my mind, think in English. I would create stories in my mind about something, whatever you can think of. You can think about that and make stories by yourself. But think in English. If English is not your native language, you can try to think in English, and then it gives you more encouragement to speak, and it also enhance your knowledge or your vocabulary. If you cannot think of any word about that story that you made in your mind, you can write it down and search or make up your vocabulary. You can just Google it. It's just simple. All right, so what you need to do is you need to practice speaking in English with your colleagues, with your friends, with your family, or in front of the mirror, or you can think in English in your mind. Yes, it's an important tip, and you need to do it every day for 20 minutes. Yeah, that's your task. Third tip I want to give you is make sure that you familiarize yourself with normal cases. I mean, cases like dementia, stroke, heart disease, or congestive heart failure. They come very often in the exam. So practice speaking about these conditions, because it will give you more insight of the condition, and then it can enhance your confidence to speak in English, or to speak about that condition in English. All right, so practice speaking about dementia for 10 minutes, or practice speaking about heart disease, any heart disease you can take, and try to teach somebody what is heart disease or what is dementia. Try to teach somebody. Let's say you can talk to yourself. Maybe you can say, dementia is a disease, dementia has these symptoms, and if any patient has dementia, what kind of symptoms do they display, and what do they do, what is their main concern, what kind of problems they have. So you can try to think in English, and then you can ace your speaking test. That was my third tip. Tip number 4 is you need to take the lead. Yes, you heard me right. You need to take the lead. You are there, you are the leader, you are the boss. Consider, I know everything. All right, when you are talking to the examiner, consider that, think that I am the boss. I know everything. I know what I'm talking to the examiner. I know what is the condition I'm talking about. I know everything. That is your top tip. And then when you are confident enough, when you are conversant in your communication, when you feel like you are the boss and you talk in that way, the examiner will think, yeah, she is the lady that I need to pass. I need to pass her in Oet speaking, or she is the boy who knows English. Yeah, that's very important. You need to be confident. You need to take the lead, and if you take the lead, you would be knowing what you are going to say and how you are going to convince the examiner that you have a wide range of vocabulary. You know the condition, you know everything about this situation, you know about the timing of the Oet exam, because there is a time limit, isn't it? So you need to speak within the time range. Don't go beyond and above and beyond the time range. And you can do it if you take the lead. You speak to the examiner in the way, you will be able to pass the exam. The next tip I have here is, do not try to impress the examiner. Yes, you heard me right. You do not need to impress the examiner. You do not need to try different accents. Use the accent that is yours. Okay, do not try to fake the English language, all right, or your accent, because when you do that, you are more likely to make mistakes. So if you are just be natural. Okay, if you are not fluent in English, what you need to do is use simple but correct English. Simple, keep it simple. What I learned when I was preparing for Oet, I learned that I need to keep it simple, whether it's writing, speaking, listening, or reading. If you keep it simple, you don't fake it, then you are going to pass the exam. All right, so what I wrote here is, if you are not fluent in English, just use basic and simple English with a mix of complex sentences. Yeah, instead of trying hard and impressing the examiner. Being your true self will give you confidence during your conversation. Yes, no need to fake your accent, just use your own. So you, as I said earlier, you need to take the lead. Yeah, you need to take the lead and start the conversation. Keep it moving. Ask the patient to make her talk. Listen to the patient as you would do in real setting. So listening to the patient, very important, is very important. Why? Because if you are confused, you are continuously thinking what I'm gonna say, what I'm gonna say, you're gonna miss the information that patient is giving to you or the examiner is giving to you. So concentrate on listening. So when you are a good listener, you will be a good speaker as well. So you need to listen attentively, pay close attention what the patient is saying, what the examiner is saying, and what I need to respond. Okay, if you are not fluent, it's fine. And what the another tip I want to give is, always look for the, if you don't understand English a lot, if you're not very fluent but you do understand, try to pick the words that you know. All right, just get a summary of that words and then understand what the examiner is trying to say. If you have no clue what the examiner is saying, you can tell the examiner, can you please paraphrase that one, or can you please repeat yourself. It's not a big deal if you are asking the examiner to repeat themselves. It's totally fine. Or if you did not hear it properly, you can ask, pardon me, can you please repeat yourself, or could you please say it again. It's totally fine to ask the examiner to repeat the sentence that they said. All right, and also you need to respond to the examiner accordingly and adjust your language. Acknowledge the patient's feelings, organize the role play. So if patient is saying, I'm in so much pain, and you're saying, yeah, I'm going to give you pain medications. No, you need to pay some sympathy. You need to acknowledge their feelings. I'm so sorry to hear that you are in pain. You can say that to the patient. I'm sorry to hear that. What do you think we can do about it? Would you like to have some pain medications, or would you like to reposition yourself? Should I help you with some repositioning? Yeah, you need to say that to the patient. Give some emotional support before you go for the medications. All right, the next thing I have on my list is expect the unexpected. Yes. All right, do not be troubled if the invigilator suddenly becomes sad, angry, or anxious. All right, if it's part of the play, you need to react appropriately. Like if you were with your patient, think of what you are going to say and do, but stick to the theme of the role play. Yeah, so when you go to the examination center, you need to prepare your mind. You need to think, you need to keep in mind that anything can happen. Same when you go to work, you keep in your mind, right? I'm going to work in a general medicine ward. I don't know what will happen today. Expect for the unexpected. Yeah, and then an examiner is your patient. He can say anything. He can talk to you in rough language also, but they don't usually talk to you like that. But they can say, can you please stop talking? They can say that to you. So they will give, if they are giving you a scenario where you need to deal with an angry patient or an anxious patient, this is the response you're gonna get from the examiner. So you need to try to calm down the patient. You need to use that language which will convince the patient, but they will not exaggerate. Okay, so as some patients do in the hospital, they are not going to do the same with you. They are going to just keep it as minimum. But if the scenario says patient is very angry or patient is frustrating, then it's obvious from the words, from the scenario, that you are going to be expecting, you are going to be expecting these things. You are going to be in a scenario where you need to calm down the patient, listen attentively, pay close attention to their words, try to sort out their situation, or try or say that there is nothing I can do at that moment, but I'm going to escalate to the escalated to the my escalated I cannot speak since yesterday I started making writing video, OET writing, and I couldn't speak. I was so clumsy. So same thing is happening today, but I'm trying to remain calm. All right, so patient can say, you need to listen attentively. You can talk to them, use a open body language, or open sentences, so they can respond to you correctly. But I'm assuring you they are not going to exaggerate too much. So just be aware that you can get a scenario like that. And at the end, what I can say is, you need to practice and be creative and just be yourself. Keep it simple, simple and easy. OET is exam which tests your common sense, your common knowledge of English. Also, they are not looking for a complex words or complex language, but in OET speaking, you can speak simple. You can use simple language with some complex sentences. Like I'm just using simple language. I'm not complicating it, because I'm just teaching you how to speak like that. So if you keep it simple, if you don't try to fake your accent, or if you don't try to use the very complicated words, it's good for you. You can pass the exam in one sitting. I know 2 or 3 of my colleagues, their English is really good. I'm giving you just an example. You won't believe, they use very difficult words, they speak very complicated English. 3rd time now they failed their OET. Can you imagine? Because what happens is, if I use very complicated word or very difficult word, English is a language where one word has many meanings. All right, so if I'm saying one word and I know the meaning of that word, I know the one meaning of that word, I cannot use that word in all my sentences, right? Maybe the word I'm using in my sentence is making totally different sense, and then because in English one word has different meanings, one word has many meanings. All right, so you cannot use the same word in too many sentences or in other sentences if you don't have vast vocabulary, if you don't know all of the meanings of that word, or if you don't know what are the contexts that I can use that word for, then it can be complicated and it can lead to a failure. But if I know a simple word and I know the meaning of that word, 100% I know the meaning of that word, and I'm sure that the word I'm using is 100% correct, I would rather use that word instead of using a complicated word, because it will give me pass. But if I'm using a complicated word and I'm using that word in my sentence in a wrong way, it's going to make me fail. All right, so you need to think and try using simple English and some complex words, and try to search that words, build up your vocabulary, but try not to exaggerate, try not to make it very hard for you to learn complicated words. Keep it simple. That is the meaning of OET. That I learned that the OET is the exam where we need to be just be ourselves. Try not to fake your accent, try not to use complicated vocabulary. If you are not sure about that, If you are sure about something, say it. All right, and just consider the examiner as an actor. They are not the real patient, so they are there to judge. They are there to check your English level. All right, they are going to assess your English level, and they are also going to assess your vocabulary. And but if you are not sure about any word, don't use it, just use a simple word instead. All right, and if you get you get two scenarios, isn't it? So we are going to practice some scenarios in my upcoming video about Oet speaking, because I have one more video pending. I need to edit it. That is for writing. I made it yesterday for writing, but I did not edit it because I was so clumsy. I don't know. I couldn't say anything. I was so my baby was sleeping and I was trying to make the video, but it was so difficult for me to speak. I don't know why. I was so clumsy. I was not in the position to make a YouTube video. I don't know why. Because I'm getting used to it now, but I don't know, something happened. But I'm not going to delete that video. I will upload that video hopefully tomorrow or today, and that video is part 2 of Oet writing, part 1 of the video. Part 1 I made part 1 a few days ago, and that will be the part 2 of Oet writing mistakes. If you haven't watched that video, you can go back on my YouTube channel and watch Oet writing mistakes that a lot of people make and they fail. I'm uploading the part 2 tomorrow, hopefully. And please don't criticize, all right? I'm not an English teacher. I'm trying my best to teach you what I learned while I was preparing my Oet exam. So I'll see you soon in the next video. If you like this video, you can share it with your friends and colleagues who are also preparing for Oet or IELTS. You can share it with them. And if you haven't subscribed, please do so. Let me know in the comment section if you have any queries, if you have any questions, if you have any doubts. I'll be more than happy to answer your queries. On Saturday, I'm going to answer all of your queries, so put your comment in the section below if you have any doubts, and I'll be making the video on Saturday to answer your questions. So thank you so much, guys. Take care. Bye bye. God bless.